Hello crystals, welcome back to my channel. Today we are going to talk about bladder control. According to me, conditions associated with this topic are really underrated. People are think leaking is normal, but it is not. It suggests the weak pelvic floor muscles, neurological and other conditions. In this lecture, we will talk about normal anatomy, nerve supply and various conditions and some exercise to strengthen our muscles. So let's get started. So the contents of today's lecture are introduction of the bladder, its anatomy, its nerve supply, what happens when bladder is full and while empty, conditions associated with it, diagnosis, management, and exercise to stop leaking. So let's start with the introduction. We are very well know about our renal system, in which two kidneys, two ureters, bladder, and the urethra is present. Today's lecture is on bladder. So what is bladder? The bladder is an organ of the urinary system. It plays common role in temporary storage of the urine. So how's the bladder store urine? Because bladder is a hollow organ with the distensible wall. So urine is temporarily stored in our bladder. It also assists in expulsion of the urine. The musculature of the bladder contracts during the micturition with concomitant relaxation of the sphincter. Next is capacity. So the mean capacity of our bladder is 220 ml. It's varying from 120 to 320 ml. Filling beyond 220 ml causes desire to micturate and the bladder is usually emptied when filled to about 250 to 300 ml. Filling up to 500 ml may be tolerated, but beyond this it becomes really painful. Referred pain is felt in the lower part of anterior abdominal wall, perineum and the penis. So whatever the work is, if you need to urinate, go and pee. Don't try to tolerate because this really harmful for our bladder and the body. Next is shape. So what is the shape of our bladder? The appearance of the bladder varies depending on the amount of urine stored. When it is full, it exhibits an oval shape, and when it is empty, it is flattened by the overlying bowl. The external features of the bladder are apex, body, fundus and neck. As you see in this picture, there is a bladder of the female and the bladder of the male. In the male bladder, there is a prostate gland is also present. Next is trigon. So what is trigon? A triangular area located within the fundus. The area is very sensitive to expansion and once stretched to a certain degree, the urinary bladder signals the brain of its need to empty. Now the musculature. The musculature of the bladder is really important. The musculature of the bladder plays a key role in the storage and the emptying of urine. The specialized smooth muscles, which are called the detrusor muscles, are present in the bladder. Its fibers are oriented in the multiple directions, thus it retaining the structural integrity when it is stretched. It receives the innervation from both sympathetic and the parasympathetic nervous system. There are also two muscular sphincters located in the urethra, which are the internal urethral sphincter and the external urethral sphincter. As you see in this graphic, there is an inner mucosa, detrusor muscle and the outer membrane of the bladder. In this picture, you can easily find out the anatomical landmarks on the bladder, which are the detrusor, bladder neck, urethra, external and internal sphincter, trigon and the ureters. Now what is internal and external sphincters? So, in the male, it consists of circular smooth fibers which are under autonomic control. It is thought to prevent seminal regurgitation during ejaculation. So we are very well know about there are two openings in the male and three openings in the females, which are the vaginal, rectal and the urethral, and in the male only two are present, which is the urethral and the rectal opening. So the semen is passed through the urethral opening, right? So the internal sphincter plays an important role in the seminal to prevent the seminal regurgitation during the ejaculation. In the female, it is thought to be a functional sphincter, means it is not anatomically present in the bladder. It is formed by the anatomy of the bladder neck and the proximal urethra. Now, external sphincter, it has the same structure in the both sexes. It is skeletal muscle and under voluntary control. Now, the nerve supply of the bladder. So, the bladder receives inputs from the both autonomic and the somatic nervous system. In the autonomic nervous system, there are two sympathetic and parasympathetic nervous systems are also included. So, in the sympathetic nervous system, there is a hypogastric nerve. So, it causes the relaxation of the detrusor muscles and it promoting the urine retention. In the parasympathetic nervous system, there is a pelvic nerve which increases the signals from this nerve, causes contraction of the detrusor muscles and it's stimulating the micturition. The somatic nervous system, pudendal nerve is included in this. It innervates the external urethral sphincter. It's providing the voluntary control over the micturition. So keep in mind that parasympathetic is responsible for the voiding, sympathetic is responsible for the retaining of the urine, and the pudendal nerve is responsible for voluntary control, so we can voluntarily retain and micturate. You can see in this picture there is a sympathetic and parasympathetic nerves. In the sympathetic, which is the hypogastric, and in the parasympathetic, which is the pelvic nerve, which are innervate on the bladder, and the somatic nerve also the pudendal nerve, means we can voluntarily control our urine. Now, a sensory nerve, the pain sensations caused by the distension or the spasm of the bladder wall are carried mainly by the parasympathetic nerves and partly by the sympathetic nerves. In the spinal cord, pain arising in the bladder through the lateral spinothalamic tract and awareness of the bladder distension is mediated through the posterior column, which is the dorsal column in our spinal cord. Now, receptors. So which type of receptors are present on our bladder wall? So there is a M3, which is the muscarinic receptor, beta 3, alpha, and the nicotinic receptors are present. So the parasympathetic nerves releases the acetylcholine on the M3 receptors, which are responsible for the contraction of the detrusor muscles. The sympathetic nerve releases the adrenaline on the beta 3 and the alpha 1 receptors. Beta 3 receptors are responsible for the relaxation of the detrusor muscles, and the alpha 1 is responsible for the contraction of the internal sphincter. The somatic nerve, which is the pudendal nerve, which is responsible for the voluntary contraction and the relaxation. As I said you previously, parasympathetic is responsible for the voiding, so there is a contraction of the detrusor muscles, and the sympathetic is responsible for the retaining, so there is a relaxation of the detrusor muscles and the contraction of the internal sphincter, so the urine is retained in the bladder. You can see in this picture there is a various type of receptors, which are the muscarinic, nicotinic, alpha adrenergic, and the beta adrenergic receptors are present. The nicotinic receptors are present on the external sphincter, so we can voluntarily control the external sphincter and to retain the urine. Now, which centers are located in the brain which control the micturition and the retaining? So the pontine micturition center and the pontine storage center. Pontine micturition center is responsible for the micturation, means the voiding of the urine, and the pontine storage center is responsible for the retaining of the urine. Now what happens when bladder is empty? I make this chart in really simple words so you can easily understand what I am trying to say. So let's start. So when the bladder is empty, sensory pelvic nerve sends the slow impulses sacral to the cord, which stimulate the hypogastric nerve. So the hypogastric nerve is a sympathetic nerve which is responsible for the retaining of the urine. So the hypogastric nerve stimulate the alpha 1 receptors which responsible for the contraction of the internal sphincter, and also stimulate the beta 3 receptors which are responsible for the relaxation of the detrusor muscles. Next is, our brain and pons know that bladder is empty. So they send impulses at the thoracic levels and stimulate the hypogastric nerve. So we can retain urine and also send signals to the sacral segments. So signal sends to the pelvic nerve which has been inhibited. However, there are signals which stimulate the pudendal nerve. It stimulates the nicotinic receptors on the external sphincter which causes contraction of the external sphincter. So we can hold our urine voluntarily. Now, when the bladder is full. So what is the main point of the when bladder is empty? So the in which the sympathetic nerve is stimulated, which allow us to hold our urine. The parasympathetic is inhibited, so we didn't contract the detrusor muscles, and the pudendal nerve is stimulated, so we can hold our urine voluntarily. Now move on. When the bladder is full. So what happens when the bladder is full of urine? So when the bladder is full of urine, it causes stretch on the detrusal muscle. So the pelvic nerve is stimulated, which increase the firing rate. It sends the fast signal to the sacral segments. In the previously, when the bladder is empty, it sends the slow impulses, and when the bladder is full, it sends the fast signals to the sacral segments. It causes a new neuron which bypasses the thoracic and lumbar area and goes straight to the pontine micturition center, where it stimulates some neurons. It inhibits the hypogastric nerve, so beta 1 and alpha 1 receptors are also inhibited. So we don't have relaxation of the detrusal muscle and relaxation of the internal sphincter. Also impulses from the pontine micturition centers which work as a one, it stimulates the pelvic afferent nerve. It causes the contraction of the detrusal muscle by acting on M3 receptors, which are the muscarinic receptors, and also inhibit the pudendal nerve which is in our control, so there is no contraction of the external sphincter, thus it relaxes. So what is the main point of the when the bladder is full? So there is no relaxation of the detrusal muscles and the contraction of the detrusal muscles, and the relaxation of the internal and external sphincters, and the voiding occurs. So after this we are continuing to pee. So there are voiding reflex occurs. So what is the voiding reflex? The pelvic nerve keeps sending the impulses to the sacral segments. It then works on the interneurons of these segments which connected with the parasympathetic nerve fibers, and which then causes the contraction of the detrusor muscle. So it's like a loop in which sensory nerve sends impulses to the afferent nerve which causes contraction of the detrusal muscles. So that is why we continue to pee. I hope it all makes sense to you all. Now, the which conditions are associated with the bladder. So there is a main condition which is known as the neurogenic bladder. In the neurogenic bladder, there are two conditions are associated, which is the spastic and the flaccid bladder. Spastic bladder is also known as the hyperreflexive, and the flaccid is also known as the areflexive or the hypotonic bladder. The spastic is also known as the UMN bladder, and the flaccid is also known as the LMN bladder. Now, which are the causes are responsible to cause the neurogenic bladder? So there are two main causes, which are the congenital and various medical conditions which causes the neurogenic bladder. In the congenital, there are three conditions are associated, which are the spina bifida, which is also known as the myelomeningocele, sacral agenesis, and the cerebral palsy. So what is the meaning by the sacral agenesis? It is a condition in which there is a abnormal or no development of the body part. So the sacral agenesis means there is no development of the sacrum, or there is no abnormal development of the sacrum. And in the various medical conditions, the stroke, Parkinson's, multiple sclerosis, spinal cord injuries, erectile dysfunction, trauma, CNS tumors, heavy metal poisonings are responsible to cause the neurogenic bladder. Now, which symptoms are related with the neurogenic bladder? So the main symptom is we are unable to control urination, and the others are weak or dribbling urinary stream, frequent urination, which is varies from 8 or more times daily, urgency, feeling or need to urinate immediately, and painful urination, which indicates the urinary tract infection. Now move on to the spastic and flaccid bladder. So what is the spastic bladder? So in this condition, bladder contracts and reflexively empties in response to a certain level of feeling pressure. It means that it is the overactive bladder, as I said you previously, that the spastic bladder is also known as the hyperreflexive bladder. The reflex arc is intact. With this type of injury, the detrusor muscle is generally hyperreflexive. Increased tone of sphincter, contraction of the detrusor muscle with small urine volumes, and lack of coordination between the detrusor and the sphincter, which is known as the dyssynergia. And the flaccid bladder, it is essentially flaccid because there is no reflex action in the detrusor muscles, and the hypotonic bladder, which is also known as the areflexive bladder. As you see in this picture, there is a normal bladder, the detrusor muscles contracting when the bladder is full, which is the normal bladder, and in the overactive bladder, the detrusor muscle contracting before the bladder is full. So it is also known as the overactive or hyperreflexive bladder. Now reflex bladder. The reflex bladder, if the injury is about a T12 level, the bladder may empty by a reflex. Any injury in this area may be able to have a reflex bladder. I can explain you a process of urination so you can easily understand what is the reflex bladder. So when the bladder fills with the urine and stretches, the stretching bladder pushes out onto the nearby nerves. The nerves send signals to the spinal cord. The message loops around in this cord below the injury and sets off the reflex. The message goes back down to the cord to the bladder. The bladder contracts, the sphincteral muscles open, and the urine is let out. It may let the urine out at the inconvenient time because the brain is not involved to determine the right time to urinate. Therefore, the person could have bladder accidents at the inappropriate times. You can see in this picture there is an injury above the T12 level and the injury below the T12 level. The above the T12 level is also causes the reflex bladder, and below the T12 level causes the areflex bladder. In the reflex bladder, there is a voiding at the inappropriate time, which is overactive bladder, and below the T12 level is responsible for the retaining of the urine, which is the areflexive. Now, what is the areflexive bladder? If the spinal cord injury is below the T12 level, the bladder will probably not be able to empty by a reflex because the spinal cord ends about L2. The signals of a full bladder have no place to travel. Since the injury is below the level of the cord, the signals cannot ever reach the cord to stimulate the reflex to occur. When the bladder is not able to empty by a reflex, it is called an areflexive bladder. I explain you the process of urination of the areflexive bladder so you can easily understand what is going on. The bladder fills with the urine and the stretches. The stretching bladder pushes out onto the nearby nerves. The nerve sends signals to the spinal cord, but they are not able to reach the cord. The signals are there but have no place to travel because the cord never received the signals and the bladder does not get a message to contract. The sphincters stay closed. The urine does not empty by a reflex, nor does the brain instruct the bladder to empty at all, since the signals are not able to reach the cord or to the brain. The bladder becomes very full. When it becomes too full, the urine will eventually leak out from the bladder, resulting in a bladder accidents. I hope it all makes sense to you all, and I hope you can understand what I'm trying to say. In addition to the problems associated with the nerve pathways up and down the cord, there are other problems that often affect the bladder size, pressures, and bladder muscle function. All of this affect the ability of the bladder to hold or store urine as well as properly release the urine. For example, some bladders may have a very tight sphincter muscles that makes it difficult to allow urine to pass. The bladder may empty incompletely, thus leaving the residual urine in the bladder. Thus, the residual urine stay inside the bladder too long and is prone to causing a urinary tract infection. Here, our first part of bladder control is completed. In this part, we have talked about normal anatomy and various conditions. To learn diagnosis and management, watch my second part on bladder control. And if you like this part, please like, share and subscribe. Thank you friends. Bye.